Hi everyone. Exam preparation can be challenging. It can be difficult to know where to start and how to approach this. Here are some tips and strategies for you to think about to help you decide how you're going to prepare both for the midterms and finals in the DOS course as well as your CPNRE. First off, you could approach your studying by looking at courses you've taken in the past. For example, you've taken courses in semester 1 such as Health and Healing and Development of Self as Nurse, Fundamental Healing Arts. You've taken courses in semester 2 such as Health Assessment and Advanced Healing Arts. You've taken courses in semester 3 such as Math Pharmacology and Mental Health and OB Theory and Practice. And in semester 4, you're taking Med Surg Theory and Clinical and finishing off your Processes of Human Disease, Pathophysiology. Some examples of the types of things that you've covered in some of these courses can be seen in the health assessment, where you have done neuromusculoskeletal assessments, neuro assessments, and respiratory assessments. In pharmacology, you examined and researched drugs for anti-inflammatory and anti-infective drugs, as well as those that would work on the central nervous system. You can break courses down and create a little diagram. For example, thinking about concepts that you've taken and then looking at what the skills were and the theory that underlay these. For example, in Fundamental Healing Arts, you covered PPE, transferring and mobility, personal care, wounds and wound care. In AHA, you covered nasogastric tubes, care of the patient with a chest tube, patients with oxygen therapy, suctioning, medication administration, IV therapy, and blood transfusions. IV therapy, for example, covered types of fluids that the patient could receive. Complications of IV therapy, for example, fluid volume excess or fluid volume deficit. You also covered IV medication administration and the nursing care of all of these. Another option that you could approach is by system. That is, pick a physiological system to explore. Apply the nursing process when doing this. It can help you organize the steps to nursing care in each area. For example, with urinary elimination. Under assessment, the purpose of any assessment is to collect data. So for this one, you could be collecting information about it during a physical assessment on the skin, bladder, kidneys, and genitalia. When you're assessing urine, you're looking at output and characteristics. You may be having to collect specimens or look at testing and lab results. There's also pre-procedure assessments, such as those conducted before catheterization. In the planning stage, you would be looking at preventing risks, such as infection, and types of techniques used to do this, as well as patient teaching, and risks such as fluid and electrolyte imbalances. You would also be planning how to manage devices such as intermittent catheterization or indwelling catheters. Another approach that you might take might be by condition. That is, where you pick a medical condition and look at the nursing care around that. Let's look at an example of this. Let's pick diabetes. First off, you'd be looking at what are the types of diabetes and what's the pathophysiology associated with these? What's the effect on body organs? What are the signs and symptoms the nurse can expect to observe or hear from the patient? For example, neuropathy or blood glucose. This could be normal or abnormal. What are the complications associated with this? And how would the nurse prioritize, intervene, and or prevent a complication? What are the nursing skills associated with care of this patient? For example, obtaining a blood glucose reading or subcutaneous insulin injections. What types of medications would this patient be on? For example, insulin or oral anti-diabetic agents. What's the action, the dose, the side effects, the onset duration, and how should this medication be administered? What health teaching should the nurse be aware of, and what health teaching would the nurse provide the patient? either about medications or for such things as diet, stress, or exercise. Remember to consider nursing process throughout this. That will help you break it down and make it more organized. What would you do during the assessment phase? What would a proper or common nursing diagnosis be with these? How would you plan for the care of the diabetic patient? What goes into implementation? And how would you evaluate different aspects? Another option that you might try is examining certain situations. These are sort of broader situations that might cover a multitude of conditions. For example, what about the patient going for surgery? So, research caring for the patient in the perioperative process. There are 3 phases in this: the preoperative phase, the intraoperative phase, and the postoperative phase. In the preoperative phase, what would take place? For example, what's the purpose for the surgery? What type of surgery is it? How invasive it is going to be? What kind of preparation might be needed for it? What are the risk factors associated with caring for patients undergoing surgery? Age-related risks, health risks, what types of medications are they on? Consider legal implications for surgery, consent, age, etc. What assessments should be done preoperatively, and what preoperative teaching might take place? Research the intraoperative phase and the postoperative phase. For example, in the postoperative phase, the nurse would be assessing the post-op patient, primarily for signs and symptoms of complications post-surgery. So knowing common complications post-surgery and writing what these are and what the nursing interventions for these are is a good strategy. In conclusion, it is good to come up with some kind of study plan. First off, collect the resources that you need. That might be your notes, your textbooks, your cue cards, and your lecture notes. Choose a study strategy. You don't have to pick one. You can combine some from the list that I've just provided. Create your own study plan. This should be very personal and this should work for you and your learning style. Keep your notes organized. Plan to do a little something every week. Keep your notes organized so that you know where they are. Try not to jump around, and that's why picking one particular way to approach it is helpful. Key thing is to start early.